What about some who will point a finger at the Bretton Woods institutions and in fact say, look at the role of the World Bank's structural adjustment programs?
Yeah, I mean, I don't want to establish a simple causal relationship, but the fact of the matter is that the health systems in Africa suffered a lot during structural adjustment because there was a very strong push towards a more private health provision, and the public health services suffered a lot. And then you add on this whole question of brain drain that took place during that phase when doctors left, and so it's a general problem Africa is facing, that we are, after 20, 30 years of maladjustment, many of our institutions are not functioning properly. And when they're hit with a crisis like this, it's quite obvious that we have, something has gone profoundly wrong in terms of institutional development in Africa.
Well, Shaka, from what I have gathered from both journalists and health officials, as well as officials of government in the region and on the continent, they seem to appear that criticisms are being leveled against the leaders of these nations because, one, they appear not to build infrastructure in terms of health infrastructure to handle such instances of outbreak. When they get sick, the accusation is that they leave their homes and go abroad to seek medical treatment, leaving their people to face whatever broken health system they have back home. And that is one of the accusations. And secondly, some of these countries deny if there is any outbreak at all. First they deny, then they come up and tell you there are solutions being implemented to ensure that some of these issues are resolved. But then when you ask the doctors and health groups that are in the country, as well as civil society groups, about what pragmatic measures the government have been putting in place to resolve these issues, they tell you there's none in existence. Yet, the case of Ebola is a clear case. Some of these countries that were hit, they said there are no cases of Ebola in their countries. 2-3 weeks later, there are several. And then it begins to exponentially magnify the problem. And then you ask these same government officials what they're doing and why they denied it from the onset. They will give you varying, reasons. But the problem is the health institutions have not been able to cope with the enormity of the problems of the outbreak. And that has to be redressed, and that is a challenge to them.